To visit or not to visit a dying loved one. Deciding whether to see a patient is not always straightforward. We'll provide some helpful tips to guide patients, families, and friends in making a peaceful decision. I spent time with a wonderful family yesterday. Three family members, two close friends, and the beloved pet Labrador were all gathered in the patient's room with her. It was a heartwarming scene filled with shared life stories, and the picture albums were being passed around. The two grandchildren had traveled a long way for a final visit with their grandmother. And what I found especially touching was that their visit wasn't just about seeing their grandmother for the last time, it was also about supporting their mom, who has been a devoted and loving caregiver for her mother for years. It was a meaningful experience for everyone, but things don't always go so smoothly. In most cases, I would say death does not come at a convenient time. Here are some important factors to think about and consider when deciding whether you can or should visit a dying loved one. First, ask yourself, do you truly want to see them, or do you feel like you should? Be honest with yourself and don't carry guilt if it feels more like an obligation. Then take it a step further and explore why you want to or don't want to visit. Try to give your reasoning some depth. Be curious and truthful with yourself. The focus isn't just on whether you visit or not, but on gaining clarity and understanding, which will help you make a peaceful decision. Second, ask yourself, do they want to see me? You may have a sense of their wishes, but more often than not, you may not truly know. If they're still able to communicate, try asking them directly or indirectly through others to gain clarity. If they're no longer awake, you will have to rely on those designated to care for them. There are a lot of reasons they may not want to see you that have nothing to do with you. Dying is hard work and energy is waning. I often encourage my patients, families, and caregivers to kindly decline visits by saying, thank you for thinking of us. We're deeply appreciative of your love, your thoughts, and your prayers now more than ever. But we ask that you support and love us from afar as we focus on keeping things as calm and as quiet as possible. Hospice has no authority or attachment to visits in this area, but I also tell families to say, hospice doesn't think it's a good time right now for a visit. It's a kind and polite way to decline visits that takes the burden off of patients and those caring for them. Third, ask yourself, is it realistic to visit? Consider whether you can take the time off, afford the trip, manage the travel logistics. Also, think about whether your loved one will still be awake or even alive by the time you arrive. Sometimes a visit may simply not be practical, and that's just reality. Whether you choose to visit or not visit a dying loved one, this is a time to acknowledge the impact you've had on each other's lives. Reflect on what that connection means for both of you. I encourage you to think deeply about this, whether in person or through a letter at their bedside. Take this opportunity to say, thank you, I love you, I forgive you, will you forgive me? This is where you will find peace. Click the link below to get a copy of our booklet, The Hospice Care Plan. This booklet's helping families and caregivers care for the hospice patient at the bedside safely and effectively.